Morning. I'd like to start the Executive Committee meeting Tuesday, February 23rd. Call it to order. 2021, by the way. If we can get a roll call, please.
Mr. Lear?
Present.
Mr. Hess?
Present.
Ms. Polk?
Present.
Ms. Weber?
Present.
Mr. Payton?
Present.
Ms. Parker?
Present.
Mr. Kinzinger?
Present.
Mr. Fairfield?
Present.
Mr. Carrico?
Present.
Mr. Featherling?
Present.
Mr. Miller?
Present.
Mr. Long?
Present.
Mr. Hunter?
Present.
Mr. Wheeler?
Present.
Mr. Searoy?
Present.
We have a quorum.
Thank you. Have no requests for public comment today. Under approval of the minutes, January 26th, 2021, motion to approve. Let's see, Mr. Payton, a second.
Parker.
Ms. Parker, beat you to it, Ms. Polk, this time.
Okay.
Let's do a roll call, please. On Zoom. Let's start with roll call on Zoom.
Mr. Lear?
Present. Aye.
Ms. Polk?
Aye.
Ms. Weber?
Aye.
Ms. Parker?
Aye.
Mr. Fairfield?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Searoy?
He doesn't vote.
Oh, I'm sorry.
Oh, wait, he does. He's on this committee. I apologize. He votes. I'm not trying to cut
It's
you.
the only committee I'm on.
You got mute for, can you mute him? Sorry. Sorry about that. It's old habit. All those in the room say aye. Those opposed, same sign. Motion carries. Sorry about that, Todd. There's a Freudian slip. We'll look that up later. I have nothing under presentations. Legislative, Mr. Lear, do you have anything?
Yes, I do. Yesterday, I attended a Zoom UCCI meeting. They started off talking about the new criminal justice law, which the governor signed yesterday, as you probably heard. UCCI is going to be focusing its lobby efforts on provisions that will become effective July 1, 2021. UCCI will partner with the Sheriff and the State's Attorneys Association in these lobbying efforts. As Chairman Wheeler has recommended to us, UCCI will be focusing on the financial impact of the law as far as county government. Just as the state appears to be mandating actions that are going to increase expenses, the governor's budget apparently is going to propose a 10% decrease in the local government distributive fund. Now, supposedly, a change in the provisions in the corporate income tax will increase revenue and make up for this loss, but we're going to have to see what happens here. There's a lot of moving parts, I guess. Two other bills directly impact UCCI. One's going to require the association to be subject to FOIA, and one, which I think has been proposed before, will create a government insurance pool that would compete with our current insurance company. That could be a really damaging thing in terms of UCCI. You can check with me on other bills mentioned, but there is one that I mentioned that creates a recall procedure for elected officials. There's another one that abolishes the coroner's office, replacing it with medical examiners in every county. Funding of 911 will be an issue addressed in this session. Both the amount of funding and whether the funding is a flat amount or a percentage. So that's something that impacts a part of our local county government. On reapportionment, current state law requires action for county board districts to be completed by July 1. But that's clearly not going to happen because the Census Bureau has announced it will not release population data before mid-September. Whoa. There is even a rumor that it might be as late as October 15th. The recommendation from UCCI is to wait for action possibly by the governor, because he does have the ability to change the date set by state law by declaring an emergency. But clearly this is going to be a complicated process this time because of the delay from the Census Bureau on population data. Also, all board members were invited to the annual meeting of UCCI that will be held at Eagle Ridge Resort in Galena on July 26th and 27th. That's another one you can see me for details, or I'll give the details to Kelly. She may have them. Or you just check the UCCI website. The March UCCI meeting will again be a Zoom meeting, so any other board member that wants to join that meeting would be invited to join, as it is a Zoom meeting. Those were the major points from that meeting.
Thanks, Steve. Question, July 1st, because I'd seen legislation for the first board meeting in July. Were they firm on that July 1st? Because there was a new law passed 4 years ago that said by the first full board meeting in July. So, and Mr. Rowe's looking into that for us. I just wanted to see what they said to verify.
The July 1st was what they mentioned all the time. They did not say first board meeting in July, but it's all really a moot point if we don't have the census data.
Right. And it's not just us, it's House districts, state and federal, Senate districts in Illinois. I mean.
Well, I think the law that applies is only for state legislative districts and county board districts. They said something about that law did not apply to congressional districts.
Well, I mean, as far as the data being able to draw those for congressional districts.
Yeah, data being able to draw is for every kind of elected legislative district.
Yeah. We'll need relief, and our legislators, I've sent them an email about that just to make sure they're aware. It's kind of frightening, because if you think about it, the filing deadline for the next election cycle of number 22 is what, November of 21?
There was discussion about the fact that there might be changes in some of those filing deadlines, which I'm sure the county clerk doesn't want to hear, because he has issues if the deadlines get moved back.
Yep. Let's see here. And by the way, the 10%, I just want to elaborate, Mr. Hunter, the 10% on those are the shared income tax funds. Those are the tax funds beyond what is generated here. It's the stuff that's generated statewide that's split up. That's the 10% that he's talking about. It's not what we normally would get with those from within our area. It's the ones that are all shared. It's substantial. It's a lot of money. So we should be concerned about that. Mr. Hunter.
Yeah, just a comment, Mr. Lear and Chairman. I know that the chairman has indicated, and we had discussed this matter, about having Mr. Ronan as well as our local legislators. We have three, meaning Representative Haas, Senator Joyce, and the sponsor of 3653, formerly House Bill 163. You know, from talking to people in the law enforcement community, they're not adverse to police reform. However, 3653 supposedly has, and I talked to the sheriff about this when I found out about it. There's $11 million in House Bill 3653 for body cams. That's a pittance in terms of what the needs are for law enforcement for body cams. You know, the problem is not buying the hardware, but the storage is a real issue. From discussing this matter with law enforcement personnel and our own sheriff, the Illinois Sheriff's Association has not been thumbs down on reform, but some of the things in there we're going to have to deal with in terms of cash bails and stuff. I mean, how do we make up the revenue that we're going to lose? And that's going to be right at your doorstep, Mr. Chairman, and us as legislators. But I'm looking forward to addressing our local legislators, and especially the sponsor of 3653, if you can get him here, not Zoom, but you know, in person, if that's possible.
Yeah, to that point, I was going to talk about it later. Might as well do it now. It's legislative. I've spoken with our lobbyist, and I've also had brief conversations because they're quite busy with our legislators. I'm told by most that we should be voting on a legislative agenda at the May board meeting. The full board should vote on what has happened at our April executive committee meeting. So this group will debate, go through legislative agendas. That's the meeting we should invite our legislators to, because they're not in session. So that would be the April 27th executive meeting. By that time, we'll know which bills have legs and which ones aren't going to make it out of committee. We shouldn't obviously focus on a lot of things that aren't going to make it out of committee. At that point, we'll know which ones have legs. We'll get our legislators here that can come because they're not in session that day, and then the full board could vote on whatever's passed out of this body the weeks later. If they're in session, most of the committee calls are later in that week after our full board meeting in May, so the timeline works out well that way. And it provides us a little time to kind of do a little more research on our side on what parts, let's say the House bill, the crime bill as I'll call it, would we like to see changed, you know, in terms of the financial side. Also gives Anita, Steve McCarty a chance to go through and look at what the current cashless bail reforms have cost us in terms of revenue that the general fund has had to make up, because that has been substantial. And then also what the new bill will put at risk, and potentially we need to have a clear picture of that for that time period. Because guess what? Budgets start right after that. So we have to start, because we just don't do the budgets the week before we approve them. We have to start earlier in the year. So all this is wrapped up into one great big present we get to unwrap when, unfortunately, it happens. So I won't get into the policing disaster that this is going to cause, people not being able to be evicted from their property. Like if you have somebody stalking orders, unless there's some immediate danger to somebody, they just write them tickets that they don't have to pay anyway. You have a business, you've banned people. You have a property, you've banned people. You can't, all they get is a ticket. They can't be hauled away for repetitively coming on and trespassing on your property. This is a complete disaster for policemen and for the citizens. You're gonna have to, a lot of times, be protecting yourself, and whatever that means. Okay, well that I just want to mention that now. We won't have to get into it later, so I'll just scratch that. Is there any other legislative things going on?
Not that I'm aware of.
Okay, thanks, Steve. Moving on then, the IS, Mr. Duval, do you have anything?
Can you hear me?
Yes, sir.
All right, I'll keep it quick. We've had a very busy month, but since the majority of the projects that we had were actually planned, we are nevertheless actually on budget. To be very specific, the last 2 weekends have been extremely busy for our department. During the 4-day weekend that we had for President Day, we were busy during that time upgrading the county's email server, which is an extensive process. It took all 4 days of that weekend. It's an extensive process because we have to build test machines. We have to build virtual machines to make sure we don't affect the daily ongoing business of the county. So something like that always has to be done on the weekend. That seems to have been successful. The reason for that was once we upgraded over the last year and a half all of the county's PCs and its Outlook version, some of the people working inside knew that the newer version of Office would freeze on them. Now you could reboot it, no problem, but if you're in the middle of a long email, that becomes a problem. If it happens 6 or 7 times a day to you, it's a problem. It's a known issue with Outlook throughout the world. We rebuilt it in an attempt, the email server, and we patched the versions of Outlook in an attempt to see if that would fix it. It appears to have done so. So it's been a very successful project. This last weekend, we did the exact same thing with the highway department because they run their own email server. That took all of that weekend to do it. And now we're spending this week touching PCs that need to make sure that they're upgraded and make sure everything's happening, but it seems to be very successful. Other than that, we're back to our main issue of troubleshooting and servicing the network. I don't know if you have any more questions, but that'll be it.
Well, I knew you did something. All my saved contacts, as far as starting typing an email address and pre-populating, They were all gone. I had to start from
Yep.
scratch. So thanks for that. Appreciate it.
It's a pain, but it's better than it freezing on you.
Exactly. Yeah. Any questions for Kevin? Alrighty. Thank you, sir, unless you don't have anything else.
No, that's it.
Okay. Moving on, Dr. Murphy. I don't know if he's here today. We do have the quarterly report. Is there a motion to put that on file? Yes.
Oh,
Okay, well, we'll finish that. Is that okay with you, Mr. Beavis? It's not like what you have to say is unimportant to the group. All right, had Mr. Hess, Ms. Polk with a second. Can we do roll call on Zoom?
Mr. Lear,
Aye.
Ms. Polk,
aye.
Ms. Weber,
Aye.
Ms. Parker,
Aye.
Mr. Fairfield,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Searoy,
Aye.
All those in the room say aye if you approve. Same sign if you disapprove. Motion carries. Mr. Beavis from our health department. World famous in Kankakee, right? Sorry about that, John.
Thank you. Good morning. I get used to just pretty much saying ditto all the time, so I guess. But I do have some information I would like to report. I have a few pages here of notes. I'm going to try to just hit the Cliff Notes version of those, and then I'll answer any questions that anyone has. Currently in Kankakee County, then, our cases as of yesterday stand at 12,439 confirmed COVID-19 cases. We have 173 deaths. We are at 11,796 recovered, so that's positive. And we are currently sitting at 470 active cases that we are contact tracing with the staff that we have on contact tracing right now. We have recently started to add to the Facebook page, and we're having some work done. It's going to take a little bit of time on our internet in regards to being able to post some of this newer information, kind of like last year when we started adding the cases and the positivity rate and those types of things. We're going to be adding the vaccination information. So in the past 9 weeks since we started vaccinating within the county, there have been 15,155 vaccinations given. That's an average of 1,600 a week for the past 9 weeks. We stand at 4,553 fully vaccinated. That is 4.14% of the total population of Kankakee County. The Illinois average is 4%, so we're right on line with that. The region positivity rate for Kankakee, well, the region is 4.5%. Kankakee is sitting at 3.3%. So following that November surge, when we skyrocketed all the way up to 20%, and the region was doing terrible with Will and ours and most of the state at that point, we have come down now significantly since then. And overall, the state positivity rate is doing really well. So the mitigation factors that everyone continues to fall, in collaboration with the vaccinations that people are slowly being able to get right now. The health department continues to add people to the sign-up list, either through Facebook, the internet, or a phone number that we have. And again, that phone number is 815-802-9449 for individuals who don't have internet access or don't have the ability to sign up on Facebook. So if you're computer savvy, you can sign up that way and get on the list that you're interested in getting the shot when you're eligible, or indicating that you're eligible now and then getting on the list. Or if you are unable to, then we have that phone number set up so that you can contact us. We'll take down the information that is important, and then we'll contact you again at that point when it's your time. There are currently over 16,000 people on the list as of yesterday. And then recently, as of last month, if you remember, we were getting ready to participate in the NAACP's town hall. That was on February 16th last week, in conjunction with, they sponsored it, and with AMITA, Riverside, and the health department, we provided a lot of good information for individuals, why it's important to get the vaccine, how to protect themselves and their family. Currently, the health department is vaccinating in conjunction with the hospitals, Jewel and Meyer, locally, to vaccinate the two groups that are currently being eligible. That's the 1A and the 1B. That is the high-risk healthcare workers. Those are doctors, nurses, dentists, hospital staff, assisted living staff, long-term care staff, home caregivers, EMS, and long-term care residents and staff. And the 1B frontline essential workers, that's first responders, K through 12 education workers, school and staff, and daycare, manufacturing business, agricultural workers, post office, corrections, inmates, public transit, grocery store workers. And then the governor added right at the beginning of that phase, the 65 and older group. Anyone 65 and older is eligible. Starting on Thursday, he's going to add everyone who's 16 to 64 who then has comorbidities. That would be cancer, kidney disease, COPD, diabetes, heart conditions, organ transplants, obesity, pregnancy, pulmonary disease, and sickle cell disease. There's been no direction on how to prioritize any and all of those individuals other than the list that we have, and we're trying to follow as best we can to be equitable. In the 1A and 1B group alone, we already figure there's approximately 35,000 people in Kankakee County that were currently eligible to receive shots and are getting those vaccinations currently since 9 weeks ago and as of today. So that's 35,000 people. We have no idea how many this 1B plus group is going to add. It's basically almost opening up the general population minus the young kids. So that's where we're at. We're going to be vaccinating as best we can, but just remember, supplies are limited. In the last 3 weeks, the health department has received 300 doses last week. We're going to get 700 doses this week, and we get 800 doses next week. The governor has indicated that we are to concentrate statewide, including Kankakee County, on our second doses, which is what we are currently doing. The second doses are guaranteed. Those are already in place, and anyone who got their first shot already will get their second dose. There's no shortage on that. There's a shortage on the vaccine coming in to our county and statewide in regards to first doses. He's promised that come March, that's supposed to improve slowly and surely, so that hopefully by midsummer, unfortunately, is the best answer I can give at this point until I know for sure, it's going to take that while. So people who are on that list, if you just signed up today, for example, and you're 16,001, you're at the bottom of the list. I'm sorry, because there's people ahead of you that we're trying to get to that feel that their shots are just as important as your shot is. It's a daunting task to try to vaccinate all these people, but between the health department, the hospitals, and the pharmacies, we're going to do the best that we can to do that.
Question.
Yes, sir.
For clarification, when you say, sorry, I turned my mic off. I was sneezing. For clarification, when you say roughly 500 doses, I heard 300, I heard 800, 600. Let's just say it's 5 as an average. Is that single doses, or is it the double doses that takes to do one person? Is it like, do you have enough for 500 people, or do you have enough for 250 people?
That's a good question. So when I say, and again, let me originally we were told we were going to get 300 doses, then they sent us 5. They told us this week we would get 300 doses, they're sending us 7. So they're giving us a little bit more than they originally said. But 700 doses would be enough vaccine for 700 first shot.
Okay.
That's a first shot. And then those 700 are guaranteed to come in 4 weeks, again, on the backside, so that we can do the second vaccination for those individuals.
Okay.
We don't have to worry about that number then falls off, and in 4 weeks we'll get a new allotment of, say, 1,600, but that 700 is going to be included already in addition to that. So that, as I said, second shots automatically will come. We don't have to worry about that. We don't have to worry about holding any back or anything like that. What we get as a first dose, we mark it as a first dose, and if it's a second dose, it's marked as a second dose, and we're having 2 clinics, first dose clinic, second dose clinic.
And
Chairman?
another reason I ask it, and I want to follow up, please, and then I'll go, who is that's next?
Mr. Seroy.
Mr. Sirai, you're next.
Thank you, sir.
The question I have is I've gotten calls from a lot of employers, people at long-term care facilities, through no fault of yours, because it's a dose situation. It's not a capacity situation to be able to hand them out. We're not getting enough to get to everybody. You're not able to say, we'll be there next week to do all of your employees, because you're dividing up that, say, 500 amongst 1A and 1B, and manufacturers and all these different segments are getting a piece of that. Is that correct?
That is correct, and let me elaborate that there's a collaboration in a couple of manners going on here. There's 2 vaccine distribution points going on here. There's the local response, which is the health department that's collaborating with, for example, Jewel and Meyer. Then there's the federal program that the state has thrown in there. CDC sends vaccine to Walgreens and CVS, for example, locally in Kankakee County, and they are tasked with giving the vaccinations to the long-term care facilities, residents and staff, behind the scenes, under the water, however you want to put that. So that's taking place already. Those facilities are being slowly and methodically vaccinated, staff and residents already. So if we're getting complaints about those facilities, that's outside of our control, but they're in the works, they're being taken care of. We're also working then with locally, the Jewel, to facilitate, and they get some of our vaccine then to go out and do the CSLs, the Van Drunens, the Kankakee nurseries, and those types of places, again, slowly and methodically behind the scenes. So then the vaccine that the health department gets, the 700 or hopefully 4,000 in a month, will be used to try to get to these 65 plus, these other individuals that have been on here, the essential workers, and obviously the underserved in our community, the hard to reach and the access to care individuals in those locations.
Thank you.
So it's a multi-pronged attack that's taking place here, a lot of moving parts. It's not just the health department. So we're only getting X number of doses a week to be able to do this, but there is vaccine coming into the county and other locations, but we have no idea or control over that.
Mm-hmm. It was just an expectation. A lot of these employers are used to setting up a time where everybody can go, get their shots at different bill, and it's just not possible with the allocations that are coming in.
And then one other point, so recently within our survey, Kayla, one of our health educators, reformatted that survey list. So originally it was sign up, as an individual that I'm interested in getting the shot. We have created a second link that is just right underneath that for businesses to sign up. I'm Joe Manager and I'm this business, and so they let us know how many individuals that they have working for them, and so we have a spreadsheet now for businesses to try to add that to our Excel spreadsheets so that we can eventually work down each of these lists to accommodate those. Sometimes they're very small businesses, and what we'll do is we will push them out to those pharmacies to have them vaccinate. But a CSL, for example, has 600 individuals that might be interested in receiving that shot. That's going to be too much. That'll overwhelm a Jewel or an Osco or somebody like that. So then that's where we're working with team. They have their own nurses and stuff, so we've got them the vaccine, and I think that they've already been done, and then we just start whittling away at the other ones.
Sure. Mr. Seroy.
Thank you, Mr. Chairman. Mr. Beavis, I'm going to back you up to some of your data that you were throwing at us at the start of your presentation. You said there was total number of cases in Kankakee County was 12,004 what?
439.
12,439. And what population of Kankakee County?
110,000 approximately.
10. Okay. So 12.
10%.
So 0.11% of our population has been affected by COVID-19?
Oh, no.
11%.
Well, that's 12,439 confirmed cases. I would venture
Right.
to guess that there have been a number of individuals who were positive who never got tested,
Well, that were sick, that weren't sick, probably, right?
or not sick enough to go get tested, or were asymptomatic and didn't think to get tested.
Okay, I was just figuring out the percentages. Thank you.
Okay.
Please check that math, Mr. Searay.
So you divide the 12,439 by the amount of people. So 12,439 divided by
About 11%.
points. Okay, 11.3.
Yeah.
11.3. There you go.
Mr.
Yeah.
Chairman?
Decimal point. Thank you, Mr. Lear.
You're welcome.
Mr. Featherling, did you have
Chairman?
something?
Hello?
Yes, Mr. Featherling.
Good morning, Mr. Beavis. How many people are left to doing 1A in the county?
I don't have an answer for that. It's hard to tell. We have 16,000 on the list. We're going to facilities. Sometimes we may end up calling somebody who's on our list when we have a clinic and it's their turn, and they may indicate that they've already received a shot through some other avenue. And then we just eliminate that name and we move down the list.
Okay, and then how about 1B, or just the same thing in that situation there? When
Correct.
you go to employer, you might have a 30-year-old guy who drives the forklift around, and you might have an 85-year-old person that's living at home that hasn't got a vaccine yet. I don't understand how the governor expects that to work out very well. I mean, why would you give out more, put more people on the list if you haven't even come close to fulfilling your list? You got 16,000 to go, and you only get 500 a week. At that rate, it's going to take you 30 weeks to even get close to even what you got on the list now.
That's a good comment. All I'm going to say is with that worm in the water, I'm not even going to nibble at that one.
Uh-oh. Who do I ask?
Well, it sounds like you need to ask the governor on that one.
Okay. Does he have a department that handles that for him?
I'm sure his
That would be-
spokespeople do.
I've been trying to reach the governor for a long time. Okay, and then pharmacies. You had mentioned local pharmacies you were trying to work with. Are you working with just the name brand, the big chain ones, or are you, CVS and Walgreens, or are you working with the local pharmaceuticals?
Well, I believe that we're trying to reach out to all of them, yes. So
Okay.
many have already gotten on board and are working in some form or fashion either with the local health department or through this federal program. We are aware of some other smaller ones that have applied to become vaccine providers, and until they're officially approved, they're not on the radar yet. And so we can't really do anything other than wait for them to join, and then we'll add them to the fray. Now, if they become part of the federal program, again, that's vaccine they get through that side of the fence. If they're working locally with us, then they'll just be added to the list of the health department, Riverside, Amita, Jewel, and Meyer that we have to share 500 doses with, for example, this week to schedule any
So
first appointments.
So whatever they get comes out of your 500 then?
If they're part of our local program, yes. Eventually, when there's enough vaccine that's rolling out there, the idea is the state will no longer require the health department to be the point of distribution for vaccine ordering. When there's enough in the store, so to speak, everyone will be able to order their own and then be able to do it. That's the plan.
Okay.
First of all, whose plan is
Pharmacy
that?
here in
It's the state health department's plan. That's what was told to us last year throughout all this planning, that we needed to be ready to vaccinate everybody. And we were ready to vaccinate everybody, and we're doing it as best we can with the vaccine we're getting.
And who approves when people apply to be a vaccine distribution point? You or the state?
The state health department does that. Approves vaccine providers. They always have.
I have a pharmacy in my district that's applied and been approved for everything. He hasn't heard anything about ever getting any doses that I'm aware of. He hasn't told me anything otherwise.
Well, okay, let us know who that is and we can reach out to them.
Okay.
If a doctor in a small town can sign up to be a vaccinator, but if we don't know they're out there and they got that approval, it's like getting a driver's license. We don't know what you got, but if you want to help, then come let us know,
Okay.
and then we can try to add you to the list.
I had people in my district coming up to me and going, I'm 65, I've been on the list for 6 weeks and I haven't heard anything from anybody, and yet you're giving out the doses to 1B and to employers and all that other stuff. You're making lists. It doesn't make any sense until you finish one section and move on to the next.
What you have to understand is that 16,000 people, including those individuals that have talked to you, are on that list. And we are trying to methodically go through that list as best we can. Every one of those 16,000 people, whatever color they are, whatever height they are, whatever sex they are, all give good reasons why they should get that shot first above anybody else. And so we're trying to accommodate that as best and easily as we can. But realize that if you got on that list 6 weeks ago and you're still at 10,000 and we're only getting 500 doses a week to be able to do those shots, the math is not good. We estimate at 500 doses a week, we'll have everyone's first shot done in 3.5 years.
That's what I kind of.
Now, we expect to get more than that soon. However, at the current pace, that's what we're looking at. So I understand the frustration of individuals who are expressing, why haven't you called me? Why haven't you called me? I see other places getting it. Well, when you go to the other side of the fence, they're all struggling too. We are not the only county that's not getting any vaccine. Our numbers are very comparative to the state and within our region as to who's been vaccinated, how many have been vaccinated in the 9 weeks. I believe that it's a heroic effort that's being done locally. We just need more vaccine. It's a supply issue.
Yeah, but if somebody's 25 and they're a teacher and they've already gotten vaccinated, and yet somebody who's 70 has been on the list for 6 weeks and hasn't even heard from anybody yet. So where does that make sense to you, John?
The health department is trying to prioritize the most vulnerable and then move down the list that way. So even though we have everyone on the list, so to speak, we are trying to prioritize as best we can. We were asked to do the 1A and the 1B first. That's what we're still working on. Those are your healthcare workers, those long-term care people, and then everyone else who's eligible. That doesn't necessarily mean that all of a sudden the new people get to cut to the front of the line. Many health departments, including ours, is possibly going to still prioritize this. It's easy to say the list is everybody, but at 500 doses a week, there's only 500 people who are going to be getting those vaccinations, and we are prioritizing those as best we can to be fair and equitable to everybody who's already been patiently waiting.
Let's go with Mr. Payton first.
As you know, I represent the eastern end of the county, and I get quite a few calls of individuals saying they can't make the schedule, they can't get on the list. But my question is, since we have a Riverside medical group right there in Pembroke, how come that can't be considered to be a site to give the shots?
It can be. It's being discussed between the health department and Riverside, and one of the answers given at the town hall last week was Dr. McHouston indicated that a survey was done by the mayor of Hopkins Park, and 4 people indicated they were interested in getting the shot at that point. I'm not denying you have individuals who say they want or are interested in the vaccination. I don't know anything about their demographics, how old they are, where they work, or anything like that in regards to where they fit currently on the eligibility list. We aren't ready to move to those kind of locations yet. Again, it's a supply issue. So what little amounts that the health department or the hospital or the pharmacies are getting, we're trying to go through that 1A and 1B list that the current, the phases the governor gave us 9 weeks ago to start with. And they just keep shoving more in the box for us to do, which is great for everybody who's in those eligible groups. But again, and I'm just gonna keep beating a dead horse here, we don't have enough vaccine yet.
Well, I don't know what the mayor told you, but I get more than 4 individuals calling me every week.
And so what we're discussing is the ability in the future when vaccine becomes available and it becomes efficient to move. That's Riverside's clinic. We don't want to go out there necessarily and step on their toes by hosting a clinic if they're getting ready to do one too. That's a duplication of efforts and a waste of time for both of us. So we're working together to figure out how best we can do that. But remember, I just said that those 500 doses we get are split between the health department and Riverside also. So if Riverside has no vaccine to give right now, that's because that's one of the reasons and they can't go out there yet. We're anticipating working with, you know, a number of church groups, community groups, places where we can go out there and do that when we have enough vaccine.
Mr. Hunter.
Thank you, Mr. Chairman. As I look at this packet here, I have heard reports, some of which are reduced to writing. You have been bombarded with questions by the chairman, Featherling, Siroy, and Mr. Payton, and now me. You have some cliff notes there. Had you ever thought about on a weekly basis informing us via email as to what's going on? And you wouldn't be bombarded with this for questions. Let me say further. We at the NAACP reached out to you. We have ongoing relationships with AMITA, Riverside, and other entities. We reached out to you. That has to be a reciprocal relationship. We appreciate you being on the COVID-19 Zoom meeting, town hall meeting last Tuesday. Let me say further. Now, I want to be clear on this. Now, you mentioned 16,000 numbers. Those are registered with you at the health department?
Are you referring to the 15,000?
No, I didn't hear 15,000. I heard 16.
Oh, I'm sorry. So, well, I'm sorry, you weren't clear. I'll let you finish the question.
Well, I have the command of the King's English. I asked you if those 16,000 that you articulated, are those the ones who are registered with the public health department?
Yes.
Okay, fine. I had a relative who was buried a couple months ago because of COVID. I know people who have died from COVID. And you have to understand all the questions been posed here because people are calling us. We see deficiencies in the process. We're not laying all that stuff at your doorstep. But we as legislators and leaders in the government are called regarding issues about their status on the list, how can I get it done, etc. You have to understand that, empathize with us. I'm going to ask you this. I understand that you're trying to do with limited supply. And if you can answer this question, I'd appreciate it. The number of overall vaccines requested and the number of vaccines administered by category, meaning shot numero uno, number 1, and shot number 2, dose. Do you have that information? Do you also have the information on demographics? And you know what I'm saying because I've asked you this before.
The number of vaccinations so far for Kankakee County are 15,155, and second doses are 4,553.
Okay, now clarify what those numbers are. The 15,155
represent the total number of vaccinations given in Kankakee County so far.
Okay.
4,553 represent 2 shots.
Okay. Now, do you have the demographics breakdown?
We are not keeping those specifically. The state is keeping that. The information that gets filled out on the paperwork, either by you or me or Chairman Wheeler or Mr. Payton, goes into the state's computer database. And if individuals at that point put down their race and ethnicity, then it's counted into the overall statistics and is on the state's website to demonstrate what that is. Now, the state has that information on its website, and currently for Kankakee County, 82% of the vaccinations that have been given to date represent white. 6.32% black or African American. 2.5% is Hispanic. And there's almost 800 people who didn't put anything down. So that's 5% that might be a conglomeration of a number of those races or ethnicities. That doesn't make us great or bad, but when you compare our numbers to Will County, that's spot on. They're seeing the same numbers in regards to what they've vaccinated so far also.
Okay, let me ask you this. Now that supports what I was saying in terms of providing information to us. Now, we know, I know, 75% of the people, 110,000 people in the county are Caucasian. 15% of the people in this county look like Sam and myself. 10% are people look like Carico. So what I'm saying to you, I don't feel comfortable about that, those numbers, but I understand that you're going to say supply. All I'm saying to you as a legislator, if I have information, I can vote accordingly based on the information I receive. All I'm saying to you, this is a crisis. People are dying. Over 500,000 people have died in this country because of COVID. It may be even more. In some of the underserved areas, they're dying by the tens of thousands. All I'm saying to you is that your particular department is very important, just as important right now in terms of public safety. It would help. It would help all these individuals who are on this particular Zoom call, as well as the county board people and the general public, if you would reduce something in writing. There's a lot of information you possess. I didn't know that I could go on the state website and find out about the numbers you gave in terms of 82% white, 6.2 African American, and 2.5% Hispanic. Would it be too much to ask you and your staff to pull together an email on a weekly basis advising of us of what's going on?
At the end of the day, the answer to that would be no. We've made it quite clear since a year ago that a lot of this information is on the state's website, and in a manner, it's a duplication of efforts for any of, I apologize that that's not, I can take time out of my day to make another report to say the same thing that's already being said somewhere.
You get a check twice a month?
Yes.
Okay, well,
that has nothing to do with COVID.
Well, it does. It does in terms of other duties as assigned to required. We look to you as the expert. What type of information, Mr. Hunter, would you like me to put in this report? Because every time we do something, put it on Facebook, I'm just asking, you're asking for another report. I just want to make sure that the more information we put out, the more questions we get. So I want to make sure then if this will suffice for everybody, Mr. Wheeler, or if this is coming from the full board, I'll make another report. No, now what I'm saying, sir, and I don't want to get into a verbal vendetta with you or a jousting with you. All I'm saying to you, that information which you've articulated today, is that on the website?
I got all this information off. I got all this information off the state's website. Yes.
Okay. All I'm saying to you, you've heard these legislators pose questions to you. All I'm saying is just provide us some information, to your county board members, so we can articulate when we get a phone call from Champaign, Springfield, or whatever about a relative here, or Mr. So-and-so lives in Skyline, or Mr. So-and-so who lives in Riverview, we'll have a base of information that we can share with them. That's all we're asking for. When you have certain information, you do better. When you know better, you do better. All we're asking for is information that we can promulgate and disseminate to our citizens. That's all. I'm done with it.
Does anyone have anything else for Mr. Beavis today? All right, Mr. Carrico.
Thank you, Mr. Chairman. Thank you, Mr. Chairman. Mr. Beaver, first of all, I'd like to really thank you for the hard work you've been doing with the health department. And I'm gonna move a little bit away from the vaccinations. I just have a different kind of a question here that would be a little easier on you. One of them is, within the service provided by the health department, do we have any health and wellness programs such as, social media or webinars or flyers that maybe could include some kind of a nutrition exercise, stress management, or certain things like that, that it's really important when it comes to the enhancement of health, prevention, improving immunity, and so on and so forth?
So yes, the health department has a health educator department. We had 3 individuals that were working with it in that. 2 of them recently resigned. We have posted for that position. We have somebody starting in March, so that'll be the second one. The individual that is currently working within that program is our main public health emergency preparedness coordinator also. So right now is helping us all hands on deck facilitate the contact tracing and the vaccination rollout that we are trying to do to get everyone vaccinated within the county as quickly as possible as supplies allow. That is something within our website. We have information, whether it's webinars or anything. Ultimately, when we have a full staff and we have more time to be able to devote to that, because many of our programs have kind of been pushed aside the past year in regards to the work that's been going on with COVID. However, we know that we won't always have COVID. I pray we don't always have COVID, and that we can begin to get back to some of those services. And now that everyone has their eyes on the health department, we can provide that education better and improve on things. We've made a number of changes to our Facebook and website as a result of COVID, and providing information out there, and can continue to add to that per requests as today, and move forward with that. But right now we're focused pretty well on trying to get the vaccines to everyone's arm that wants one.
Okay, well, thank you. I understand about the vaccinations, and I understand that you've been working hard on that. And my question was not in relation to the vaccine, it was not in relation to COVID, it was in relation into total health, because we have other things besides of COVID going around.
Exactly.
So my thing was just focusing on the total health and wellness and prevention and enhancement of health.
Right, so thank you. We do have that. We are trying. The 2 people who recently left us were very instrumental in getting a lot of that information out there. So the existing individual at this point is a little involved somewhere else, but we're hoping that one of these, the new individual who will be starting in March, will try to throw some of that work her way and see if we can slowly improve that.
Thank you so much.
Any other questions for John? Well, just to sum it up, I can tell you that I've been in conversations with Phil Cambick, Chris Schride. Especially Phil has jumped out and said, I'll do 1,500 a day if they'll give it to me. And John knows that. We've got dedicated people ready to go once we get the actual doses to be able to get out there. And like you said, at 500, well, actually, let me ask a question. Is it still 30% of the populations that are saying they want the vaccination? Are you still seeing that number carry through, or has it gone up?
I feel that it's gone up. We're basically going day to day, looking at facilities or locations that we go to and anticipating how much vaccine we would need to take or for a clinic at 50%. We feel that early on, a lot of people were apprehensive, not sure. For whatever reasons, they didn't want to be the first in line, so to speak. And now that they see that the vaccinations are going really well, the side effects are minimal and pretty much what you would expect in any other type of a vaccination, a lot of people are changing their mind. And so again, some of those 1A and 1Bs that we've already been through, a number of hospital staff, educator staff from the schools, they're calling us up now, and because they missed their first opportunity when the vaccine was available, and now they want the vaccine. Yes.
Yep. So even at 50%, it's still 6 years before we get through this county at 500 a week.
At that rate,
Just
yes.
perspective, please, for folks. Everybody.
And then lastly,
grace and perspective.
The governor indicated yesterday that the Johnson & Johnson, I think, is beginning to go through its final stages for approval. So maybe by the 1st of March, we might have 3 vaccines out there and available, and then that'll be 3 vaccines and more that can eventually be sent into our county. And as Mr. Wheeler indicated, between the health department and the hospitals and all those groups that are ready, willing, and able to give vaccinations, we anticipate we could easily do 4,000 a week. And we can do some serious arm damage with 4,000 a week, but not 500.
Right. Okay, thank you.
Thanks.
Moving on to VAC, I have a monthly report and the governor's yearly report. Can I get a motion to combine and approve? Mr. Payton, second. Mr. Long, can I do roll call on Zoom, please?
Mr. Lear,
Just a minute, please. Aye.
Ms. Polk, Ms. Polk, Ms. Weber,
Aye.
Ms. Parker,
Aye.
Mr. Fairfield,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Seroy.
Aye.
Ms. Polk, did you have a vote?
Yes, aye. I'm sorry.
No, that's okay. I saw you unmuted. Those in the room, motion to approve, say aye if you approve. Those opposed, same sign. Motion carries. Did you have anything for us today? Karen?
I would just like to add to the whole conversation about shots that our local clinic over in Bourbonnais on February 14th had about 390 shots available for 65 or older veterans. And this last weekend on Sunday, they had another 200 or 300, I'm not sure what the quantity was, for veterans. So a lot of the veterans in the area have had the opportunity to get the COVID shots through the VA. So I think that's a great bit of information. And as they get shots available, I usually put it out there on our website so that the veterans know too. So I just wanted to add that.
And those are all through the VA, federal, nothing come through local, correct?
Correct.
Okay.
Absolutely. Everything's through the federal government that way.
Alrighty. Any questions for VAC?
I have one.
Yes. Ms. Weber.
I'd just like to compliment you, Karen, on the extensive report and all the details that we can learn from your work and how effective you're working in our community. Thank you so much.
Thank you, Carol.
Alrighty. Sorry, Mr. Hunter.
Karen, just want to kudos to you to piggyback on that comprehensive specificity. I don't need to bug you about stuff because it's here, reduced to writing. Additionally, I just want to say thank you again for participating in the Kankakee County Citizen Rapid Response Team training. That's a group of individuals who work with law enforcement throughout the county, from Pembroke to the west coast of the county, Reddick, and north to Grant Park to the southern regions of the county. We interface with law enforcement in trying to promulgate accurate information which may be contrary in the communities and on social media. Karen was one of, was it 10 or 20? No, it's 20, I think. We had training Thursday night and Saturday morning at KCC, and I just want to thank you for participating and being a volunteer for that particular program.
You're welcome, and it's my honor. Thank you.
Alrighty, moving on then. County Administrator Report from Anita Speckman.
Good morning. I sent you in the packet 2 of 3 financial reports or Blue Cross Blue Shield financial and utilization reports that I received late last week. These are the first actual utilization or reporting of this kind we've gotten from Blue Cross Blue Shield. As you may remember, that we switched from United Healthcare to Blue Cross Blue Shield January 1st of 2020. We didn't get previous reporting because it really took a little bit of time to build any sort of a trend or be able to track anything in any meaningful way. So the two reports that we are getting are a monthly financial report. They're different. They're a little bit different. They look at things a little differently, so we'll kind of talk through. I pulled out for the presentation today some key indicators throughout the report. So each report runs about 30 pages. I got 3 of them. The monthly financial report looks at a plan year, so January 1st through December 30th. And we'll talk through those numbers first. Both reports are now going to be available to me on a monthly basis on a 1-month lag. So we'll start to get them monthly. It'll become more helpful over time. The financial report that we're going to look at is the report as of January 31st. I got the December 31st and the January 31st reports. I liked the January because there's a prior year, so you can compare year over year. So that's why in terms of the financial report, we're going to look at January. So if you flip to the next page, which is actually page 4 of the report, the key indicator here is the number and the makeup of our enrollment group. So you can see there are 909 total members in the group. That includes employees, spouses, dependents. There were 888 in December, so we had a slight increase, not huge, but a slight increase during open enrollment. So a few employees came on, maybe chose it perhaps were from outside the county, getting coverage from another employer, like a spouse's employer that switched over to the county. So we had a little bit of an increase. It's not due to new employees. We didn't have that many new employees. So it would have been somebody who had coverage elsewhere that switched to the county's coverage for 2021. I would say that overall, in the year that we've had Blue Cross Blue Shield, we've had terrific feedback in terms of what's covered, in terms of the network, especially the pharmaceutical benefits. So I think maybe there were employees that had historically coverage elsewhere under their spouse's plan that kind of gave it a year. After a year, we saw an increase in our employees coming over to our plan. You can see down below both employment or participation by gender and participation by tier. I will say that in my conversations with Blue Cross Blue Shield, they do indicate that the family coverage at close to 50% is a bit high compared to maybe a benchmark. So nearly half of those participants in our plan have family coverage, so spouse and children. Questions? If you flip over to page 6, this is really critical. There's a couple lines because it compares January 2020 to January 2021. And if you go down to paid by the provider, if you look at January 2020, those claims paid were $84,000 and a little over. January 2021, $344,000. So a dramatic increase. Of that $344,000, $151,273 was one claimant. So
I just want to mention, keep in mind that a lot of people were waiting last year because of COVID to go this year on some things. So that I've talked to a few health insurance people out there. That may be why we've seen an increase, but there was a large claimant as well. I know you know people like that. They didn't want to go near hospitals last year if they could avoid it. So.
If you look down below in the smaller grid, you can see the $344,000 is the medical payment, and then right below that, the pharmacy paid increased in January of 2020 from $32,165 to $101,995 for the for January 2021. Again, a lot of that related to that high cost claimant. You'll see that HCC, that acronym throughout this report, that's high cost claimant. Those are claimants that have over $50,000 in a claim. So we'll talk about that throughout these reports. The next page, page 7, shows the trend in terms of the loss ratio. And this is important for us. In the last several years, we've talked about an MLR rebate in the fall. What's happened is there's a target that for large employers under the Affordable Care Act, 85%, it's 85% for small employers, 80% for large employers, of the cost of the premium has to go towards care. So if you look at 80 to 85%, that's really close to where an insurance company wants to be in terms of the premiums they receive, what gets paid out in claims. And we were at that level through September. And then you can see what's happened here, October, November, December, January. We are over 100%. So what is happening is Blue Cross Blue Shield is paying out more in claims than they are receiving in premiums. So while 5 months is starting to be a trend, we're going to want to watch that. I will say in my conversations yesterday with Blue Cross Blue Shield, they're not raising the alarm yet at this point, largely because as we get through here and take a look, there is this one very large claimant. The number of large claimants, high cost claimants for us is relatively low compared to the benchmark that they typically see. So they're hoping that this is an anomaly and these payments kind of get reduced back into the normal range down around 90% or so.
So where is it?
Mr. Hunter.
Yeah. So what's the status of that claimant that you referred to that impacted these numbers? I mean, what's the status of that person?
They are still receiving treatment. So if you look down at the bottom under key findings on this page 7, the medical and pharmacy loss ratio was 21.2% higher than the average of the most recent 12 months. So it is, it's trending up markedly. The next page, page 8, is key. Really, it's a lot of numbers, but the key thing is if you look at the top Medicare primary indicator, no, that means Medicare is not the primary insurance provider for most of our employees, correct? Most of our group, right? So no, so that's the bulk of our members. In-network versus out-of-network. So in-network is 99.7% of claims, 99.7%. So what that's saying is the network at Blue Cross Blue Shield is so good. Our employees, our members are staying within the network. So that's good. It's more cost effective for our employees and their families. It's better for the provider. It helps keep costs down. They've got contracts with those providers, et cetera. That's a good trend. That's what we want to see. Now, the next 2 pages I'll talk together. We talked about this high cost claimant. This is because, remember, this report is a plan year. The plan year starts January. So in January, we had one high cost claimant, and this is the information there, and that's where you can see over on the right-hand side, $151,237 paid in plan year to date, which is 1 month. Plan year to date. So as a comparison, the next page, if you flip it over, this is the December report, which is the plan year from January 1st of 2020 through December 31st of 2020. So you can see there were 8 different high cost claimants. And if you look over on the right-hand side, paid, you can see the paid amount for each one of these claimants. And then currently enrolled, right there, you can see the one subscriber of these high cost claimants 2/3 of the way down. Currently enrolled, no. So that claimant actually is no longer working at the county. So what that does, Blue Cross Blue Shield also looks at that to understand whether these chronic issues are going to continue. Is this a long-term, is a short-term trend? So as they're looking at our group, they're looking at trends and what they can anticipate. So they actually made note of that in our conference call yesterday. So there were 9 high-cost claimants. You can look at kind of a different diagnostic category. Musculoskeletal, while it could be a broken bone, but it's also hip, knee replacements, so something with the bones. We see several of those. Moving on to the next page, which is page 17 of the report, is it's a pharmacy look, and again, it's a lot of numbers, a lot of detail. The key number being, if you look down the second column from the left, you have prescriptions and then the percent of total prescriptions. Down towards the bottom of the page, it compares generic with brand name. So you can see that our member group, 80% of their prescriptions, they are using generics. Again, very good for the members, very good for the providers. It keeps the costs lower. In the plan year ending 12/31 of 2020, that was actually 86 generic and 14% brand name. So that's very good. High rate of our member group choosing generic brands for their prescription coverage. And again, I do want to point out, more than anything else in the last year, that's what the feedback that I have received is that our employees and their families are very pleased with the pharmaceutical coverage of Blue Cross. That's it for the financial report that I pulled out. I don't know if anyone had any other questions about the full report that I didn't cover.
What does the committee feel? Maybe like a quarterly report for the month after we get the quarter, because it's a 1 month drag. So the first, if there's a way, I see that as a value to see kind of where we're running. Because as we look at budget time, we could almost predict that, well, based on the fact that we're running hot, we should see an increase in our health insurance. So it would be what, April, July? It's about, then don't have to come back every month because you won't be able to identify trends. She will have already done that. Does that sound like a plan? Okay.
That's good.
Okay. Any questions?
Good report.
The next report is a utilization report. So remember, the financial report was a plan year. This is a rolling 12 months. So every month, now that we've got 12 months in, a prior month will drop off and one new one will get added in. So it's a little bit of different look. So the financial report, when we looked at the plan year, that was 1 month. This gives us a full 12 months. So it's a different look. The one thing I will say about this 12/31/2020 report is the most current one. I did not get one in January, for January. And while it says paid 11/1/2019, that may be their default on their report, but our coverage did not start until January 1st of 2020. So it's really those 12 months. It's not back to November 1st. Flipping the page on page 6, this again goes to the demographics, and if you look, it does, it talks about benchmarks. Throughout this report, what I did like is looking at their benchmarks. That's what Blue Cross Blue Shield assumes, and we want to keep that in mind because that is what helps them determine their premium amounts. So page 6, if you look, and one thing that did strike me is the average age. The average age of our participant is 33.3 years old, so rather young. The benchmark is 34.8, so we're a little bit younger than the demographics that Blue Cross Blue Shield's to set premiums. The next page is page 8 that I want to point out. Page 8 talks about key indicators and how our members are using their benefits or where they're using them. So at the top, it says inpatient facility. So admissions per 1,000 for the reporting period is 40.7 for our group. The benchmark is 46.7. So our members are being admitted less, 13% less than what the typical benchmark is. And in addition, the average length of stay is 3.2 days as opposed to a benchmark of 5. So 36% less than what the benchmark typically is. So our employees are admitted less and stay for a shorter period of time for inpatient services. On the flip side, if you look at outpatient facilities, the visits per 1,000 for our members are 2,741 compared to 1,367, so over 100% increase over the benchmark. Now, is that right or wrong? There's not a perfect answer. Outpatient treatment for anything is less expensive than inpatient, so maybe that's a good thing. Maybe it's a good thing that our members are seeking treatment sooner until it gets to a catastrophic level. So it could be actually a good thing rather than a bad thing that we're so high. And then prescriptions, if you go down to almost to the bottom of the page, prescriptions per member, 9.7 during that period, so about once a month, as opposed to 9.9, so right about the benchmark. So about prescriptions, we're not way above or way below. We're about where Blue Cross Blue Shield has anticipates it being. Next page is page 14. And this is a quick graphic on these high-cost claimants. So during the period that we're talking about in this report, we had 8 high-cost claimants. That is 0.9% of our membership. The benchmark for Blue Cross Blue Shield is 1.5%. So while we look at these high-cost claimants and think it seems like a lot, and it is a lot. It's a lot of money. It's a lot of families impacted with a serious illness. It is less than what Blue Cross Blue Shield typically sees. So we have a relatively healthy member group, which is good news. And of the total amount paid by Blue Cross Blue Shield, these high-cost claimants are 23% of what they paid out. These 8 people, 23% of what Blue Cross Blue Shield paid last year went for these 8 people. Typically, that's 42%. And there were, during this period, 0 repeat high-cost claimants. So sometimes what you see happen, and they said it is pretty typical to see a high-cost claimant. Now, we only have 1 year, and that may be why, but you'll see a high-cost claimant come back again and again, and maybe have 3 or 4 serious high-cost claims. That has not happened. We're at 0 repeats. Again, this is another look at the 8 high-cost claimants from last year. Over on the right-hand side, prior HCC, do they have previous high-cost claims? No, none of them did. Then moving on to emergency room diagnosis. So what this is doing is looking at an ER diagnosis and then kind of putting it into a general category. What we want to see, Blue Cross Blue Shield then looks at that and says, is that something that an emergency room visit is required, or would it be better served by going directly maybe to an lower cost option, perhaps your doctor's office or et cetera. But I will tell you this, if we look at, so 23%, their indication is 23% of our ER visit were potentially non-emergent, potentially. So the only comment I would make with that is whether or not something is an emergency probably relates more to whether or not that's a member of your family. So if we turn the page, we talk about those people who went to the ER more than one time, right? So the one person who went, the one member who went to the emergency room 3 times, all 3 times it related to a dependent. So that was somebody's child. Again, I'm not going to make the determination whether or not maybe that person should have waited till the next morning to go to the doctor's office, right? Especially at a time when we look at COVID and the difficulty trying to get into a doctor's office. So, but still, in terms of these ER visits that they consider potentially non-emergent, my conversation with Blue Cross, this is extremely low, extremely low. They said that it's not unusual for them to see the claimants, the multiple ER visits in a year, that it's not unusual to see some members of a group to go to the ER 10 times in a year. So the fact that we have one member who went 3 times is extremely low. Again, goes back to our group. We've got a really good member group here that is using the insurance in the right way. They're seeking their doctor's advice first. They're not using the emergency room as their primary care physician. They're relatively healthy. They are relatively young. So we have a good group here, I guess, is the bottom line. The last page I want to talk about is page 31 of the utilization report. And that is preventative care. We're not in a bad way compared to the benchmark. If you look at the top, cancer screenings, cervical cancer, the benchmark is 25.5, and we were at 28.9, so higher. So that's very good. Colon cancer screenings are good. The one thing would be we're a little shy on mammogram screenings. So the benchmark is 43.5%, and we're at 41.1%. Down at the bottom, primary care physician care. So primary care, what tests are our employees seeking from their primary care physician that are preventative? Now, I do want to say, as a reminder, under the Affordable Care Act, preventative care is 100% paid. There's no deductible, there's no co-pays, so this is free stuff. The cholesterol screening is really the most obvious, where we maybe could do some education of our member group that this might be something they want to talk to their doctor and have done. annual physicals, you'll see that's not bad, 37.6% as opposed to 38% of a benchmark. So I did talk to Blue Cross Blue Shield. They're actually looking for some communication tools that we could send out about preventative care to send out to our group, like maybe on a monthly basis, send some flyers or something to be posted throughout, just reminding people to have those preventative care appointments made and take care of themselves. So those are kind of an overview of those two reports. Does anyone have any questions about where we're at with that? No? I will say it's interesting as you look at this, and you know, these, especially the high cost claimants, these people that are high cost claimants really work with our department. Every piece of the way of what we do touches them. We work with them on FMLA, we work with them on their group health insurance, we work with them on their leave, maybe a short-term disability option. A lot of what we do interacts with these group of employees. So we hear from them a lot through these times, and in talking to Blue Cross Blue Shield yesterday, I said, you know, it's so interesting because this is the first time I saw numbers, but to see numbers doesn't really equate to what some of our employees are dealing with when they come to work every day. And it's important for us to be reminded of both sides of that.
Any questions for Ms. Beckman, Ms. Weber?
I just wanted to compliment what a partnership this becomes between Blue Cross keeping these records so you can help plan, and also to help the patient, help our employees if there is a need or some area of education. So it's a very helpful report. Especially, I read the utilization report first, which was really positive, before I read the January report. But it's also good that Blue Cross commented that we are better than many other groups. So good job.
Mm-hmm.
I'd say probably the videos that we're doing for employees to help them understand their benefits might be helping. You know, we're getting good viewership on those. So the initiatives that Anita's undertaken, educating on the plan is key. Premiums go up if you use the ER too much, or you're not asking for generics, or you're not managing your own plan and you're using it like a punch card. Then all of a sudden the employees are so happy with the insurance, might not be so happy because you got to change because the rates went up because you misused it. So it's good to see everybody pulling on the same end of the rope. So, any other questions? Did you have anything else? Nope. All right, thank you. Moving on.
Mr. Chairman?
Yes, Mr. Lear.
I have another engagement I'm going to have to attend, so I'd ask to be excused.
No problem. Thank you, sir. Going to administrative, need a appointment of Christine Allen to the Limestone Fire Protection District, reappointment of Mark Rogers, Kankakee County GIS, along with Lori Gadboy to the County GIS, Eric Blair, and Timothy Nugent. Those are all reappointments and appointments. Can I get a motion to combine and approve Mr. Long, Mr. Hunter? Roll call on Zoom, please.
Ms. Polk?
Oh, I'm sorry.
Ms. Weber?
Aye.
Ms. Parker? Mr. Fairfield?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Seroy?
Aye.
In the room, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. Announce some openings real quick. 3 on the Mantino number 9 Drainage District, 3 on Moment's Pembroke Union Drainage District number 1, 1 on Raymond Drainage District, 1 on Spring Creek Drainage, 1 on the Union Drainage District number 2, 1 opening Yellowhead and Washington Union Drainage District number 2, 7 openings on the Regional Planning Commission, 1 opening Essex Township Fire Protection District, 1 on the Kankakee Township Fire Protection District. Is that still the case? It is? Okay, it's another one. Okay. and 4 openings on the Blooms Grove Cemetery Association. Moving on. Any new business to consider before we move into old? Alrighty, old business, e-waste intergovernmental agreement update. I asked Ben to join us to tell us about what municipalities are on board, where we're at, in a general, brief, succinct way, and if there's any questions, because this is dragging on to a long meeting. Do you have anything for us, Ben? Because we still have more things to tackle. So.
Yeah, just very briefly, Mr. Chairman, I want everybody to be aware. So we have an executed agreement with Karma, executed agreement with Manteno, executed agreement with Herscher, St. Anne, and Hopkins Park. So we've got a good kind of mix there. That's 7 communities that have signed on. We do have only 3 no's so far. I do have correspondence with 3 other communities that we're working through their process on first reading to second reading. So I might be out and about in the communities doing a little bit of finalization with it, but just for the committee's edification to know, by executing that Karma agreement, by putting together the funds from Manteno and then obviously the county funds, we're going to have plenty of funds to execute an agreement with our vendor and still have funds for marketing this program. It's not going to be fully funded, but when we say not fully funded, it's going to be nearly fully funded, because the couples that we've had the no's for aren't big dollar figures, and we're still going to go back to them and work on them and explain the pitfalls of not being part of the program. But we wanted you to know that it's moving forward. Obviously, it takes time, but the chairman's signing the agreements as they come through.
Sure. And what we're doing is we're going to execute the agreement with the vendor. We're putting in the tracking criteria into the agreement, so we make sure it's codified that what information we need to fulfill our end of the program that we need from them. You know, where's it coming from? What is it? You know, down to the person, you know, so we want to make sure that we're accounting for this on a yearly basis. So, and they're going to do the same. So we're close. It's up and running for those municipalities in Karma, Kankakee, Bradley, you know, Bourbonnais, Roma Park. I don't think I missed anybody, did I? Okay. But those, they're in, and so is Manteno. Those are the ones who are currently doing it. So we do have a mechanism. It is up and running, but we want the public to be able to start going. We want it as close to March 1st as possible, and we'll let everybody know. We'll have an announcement when that happens. So it's not there yet, but it may be ready by the 1st. Yeah. And who opted out, Ben? Who were the 3 that didn't do it?
So Salmon's Point, they have no levy. The Village of Chabance on the county line, they've got a program for their existing collection through their vendor, and then Limestone.
Okay. Thank you. Any questions on this? Mr. Long, yeah, just a moment.
Limestone?
Hold on, let me turn you on here. There you go.
Do we know why Limestone opted out? Is there any information, Ben?
I have not had a chance to follow up with the mayor. I know that I did present to them, and I thought we had relatively positive feedback. It just appears we didn't get an invite to that meeting, so I don't know what the overall dialogue was, but I do need to reach back out to the mayor and see what was discussed at that point.
All right, so just in the corporate limits of Limestone itself is a no.
I'm aware.
Yeah, they'll have to pay. If their residents would have to pay if they go do it. Okay. Moving on, real quick, we have a proclamation in your packet that was supplied, actually Dell asked me to bring this forward. I'd like to waive the reading and see if I can get a motion to approve this. Mr. Carrico, a second, Mr. Kinzinger. Basically, you see all the language there. It's a building code, building safety month, if you will. And then just something that we want to make a motion here, send it to full board for the proclamation. So we have a motion and a second. Is there any questions about this? Well, let's do roll call on Zoom, please.
Ms. Polk? I'll come back to her. Ms. Weber?
Aye.
Ms. Parker?
Aye.
Mr. Fairfield?
Aye.
Mr. Featherling?
Aye.
Mr. Miller?
Aye.
Mr. Searoy?
Aye.
Ms. Polk?
Aye.
All those in the room, motion is to approve. All those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. In-person Kankakee County Board Committee meetings. Mr. Hess, you had asked me to discuss this. Please, the microphone's yours.
Yes. Since we've moved into a different tier here, I was wondering if we couldn't go back to in-person committee meetings. We have enough room in here to seat 18, I believe.
It's 21 is the total for the room.
Okay.
Yeah, 21 is the total for the room.
I was talking from this area back, 18 here, and then your 3 up there would be the 21.
Well, it's 3, 6, 9, 12, 13, 14, that's 15,
and then
16, 17.
Okay.
We could board member there. The largest committee we have is 16. So we could fit board members and, you know, Kelly in here to have a meeting. The question becomes, well, the full board's out because
Correct.
the 21 is the max in this room. Department heads, press, everything. So you got to leave press in. There always has to be room for press to be in the room,
Correct.
even though they seem to watch more than they
But
show
we have
up.
seating out there for a department head that's gonna,
Exactly.
he could come in and it's his turn, his or
Right.
her turn to make a presentation in that.
Correct. And, you know, the only thing I will say is that because of the suspension of OMA, you know, as far as people being able to Zoom in and HIPAA and all those other things, we can't force people to come to the meeting, but we can strongly encourage people to come back into the room because we have room to space out the 6 feet for committee meetings only. I will say that, you know, I've seen some things that are not, say, becoming of elected officials on Zoom. People forget that they're on Zoom and they start having conversations with other people and not wearing proper attire, not showing their face forever, you know, changing backgrounds. It's something that it's problematic for me, Zoom is, because people forget that we're here representing districts at times. They think we're just sitting at home in the PJs, and that's not acceptable at all. So I would strongly encourage the board to come back to committee meetings in person, but you start to get into a slippery slope when you say you have to be here because there are at-risk people. You can't ask them that because of HIPAA, but obviously it's a concern. So I don't know how anybody else feels about this, but I think it's time to come back in the room because we can do it, as you said, but not for full board.
Right.
But we cannot mandate it.
And I checked with the sheriff, I think we could go criminal justice back out there because he's got more room there than what we have here.
Yeah. Yeah, so I don't know how the board feels about it. All I can say is consider it. Is there anybody have any thoughts on this coming back in the room?
I do. I'm probably the only one.
Yes, Ms. Polk.
Oh, I said I do. I'm probably the only one.
Well, as far as wanting to not come back into the room?
Yeah, for a while.
Well, there may be others. So yeah, you're not alone in that. Don't think you are. So, and everybody's opinion is respected on this matter. You know, with technology, I think we've learned that we could do this indefinitely, if the OMA was suspended in this right. But the question then becomes, should we? We could do it and still do business, but I think something suffers. And I think everybody would agree that something has suffered. You know, that being able to look people right in the eye as you're having a debate. Correct. You know, hey, you too. Don't make me come back there. No, I'm just kidding. But you know what I'm saying. So just consider it. I strongly consider it. And even if you are going to stay home, let's kind of step it up a little bit. No, not room full of people talking. You know what I mean? We need to be performing like elected officials sometimes if you're staying home. Yes, Mr. Hess.
I would like to see the criminal justice starting in March and move back out to the public safety building if possible.
And we have Zoom issues out there. We can't, we don't have the ability to bring in people to a Zoom meeting at that facility.
Okay.
That's the only reason we have problems, because it's all got to work together with the broadcast software, and we can't get that type of coordination out there. And I would defer to the people who actually know what they're talking about as why, but there is reasons.
Okay.
So, and then, you know, for the full board, we could go rent someplace, but I don't think we want to spend that kind of money, because we'd have to not only rent a place, we'd have to bring all the equipment with us. Yeah. And be able to broadcast and like we do live, and all of our OMA exceptions depend on live broadcast and public comment being able to call in. you know, we may be able to have public comment there, but in a gymnasium, but what's the price of that cost? At least $3,000 a meeting, we found out.
No.
Bare bones.
Don't want that.
Yeah. So, all right, thanks. I just want to have that discussion, and because Mr. Hess asked, and I think it was relevant now. Please come back if you can, and feel safe. Don't risk your health. I want to give you a redistricting update. The Redistricting Committee is a tripartisan committee because we have 3 parties on the board. So it's made up of Mr. Hess as the chairman, Mr. Payton as the vice chair, Mr. Featherling, Ms. Parker, Mr. Hunter, Mr. Seroy, Ms. Weber, Ms. Polk, and Mr. Collins are the committee. And so the timeline is, and Mr. Leard mentioned that, the full board, you know, needs to approve and send to the county clerk. What I had here by the statutes was the July full board meeting. We'll definitely have that hammered out. We're not going to miss the deadline, because that's something you do not want to do. None of us wants to see that happen, and it won't happen. So worst case, it'll be approved the month before, but again, we may not have data to even begin this. So we're going to progress like the data is going to be here until we know it's not, okay? So the Redistricting Committee, we're going to meet in a public meeting. All of these are public meetings, broadcast, with people able to come in. Public comment will be at all of those meetings. I'd rather public comment be at the end of those meetings after they see, instead of before, what's going on. It's much better to react to it and have public comment than to have it in the beginning, when I found that sometimes that doesn't actually happen in the meeting, what they think was going to happen in the meeting. So at the end, I think is more appropriate. First, they'll vote on a series of foundational items related to the process, and Mr. Rowe is going to go through this in the meetings. So you'll have the legal side of it, and then we'll have the job that needs to be done and what those timelines are within that job. You know, first you're going to need to know how many single member districts they're going to have, whether it's 28 or if it's 24 or 18 or 12. You know, 76% of the counties in the state of Illinois are single member districts. We're looking at the statutes. I believe we missed the opportunity to go multi-member districts. There used to be 7 4-member districts in the county. That opportunity has to go out to referendum. That's my opinion. Mr. Rowe's checking that out. That would have had to have happened last year. I think we wanted to stay with single member districts, and we had a referendum on that in 2010, and the voters said they wanted 28 single member districts back then. Some people forget that. We talk about that the voters had another opportunity to say they wanted 21, and they did say they wanted that as well. So just remember, there's 2 votes that happened out there in the last basically 10 years, what the voters said they wanted, and 28 yes, single member, and 21 single member. Well, not, they didn't say single member because that wasn't part of it, but just 21 members total. So that has to be considered as well. The type of pay, is it going to be salary or per diem? Salary means we take what the typical per diem would be for a board member, which is about $3,000 a year if you come to all the meetings. If you miss, you don't get paid. Well, if it's salary, as we've had a board member argue for, they get paid regardless if they show up or not. Obviously, I think you know the way I would feel about that, and I think most people would at the same time. You get paid when you show up, but that committee will decide that, vote on all these things, send it to the full board for their final approval or amendment or whatever. So the board members now get $70 per diem with no health insurance or mileage to and from the meetings. As I said, roughly $3,000 a year if they go. You'll have to determine the salary of the chairman and the liquor commissioner at that point. Usually that comes later, but in reapportionment years, it comes at that point. The final decision by vote of the Redistricting Committee should be completed and sent to the full board for April. And so if you know, this is, so then the work begins on the map. Once you determine how many districts there are, then the map can happen. And that work just doesn't happen overnight. We have a program. We spent $5,000 on this program. It's really nice. It really helps. You can't just move streets. You've got to move census blocks. I've been doing it for about 3 weeks just to make sure I was versed in it and our GIS team is versed in it. So it's a project, to say the least. So the first thing has to happen so we can do the next bit of work. And I'm saying we should do this by April, because then we got more time to do it. If we're delayed, that's just more time. We could be done in July, or we may not be done. We could get done and then say the new census gets downloaded into GIS, and then we may have some minor adjustments based on populations moving. So again, we'll talk about all this in the meeting, but in executive, I wanted you and the public to hear that this is going on, but the committee will make those decisions and then recommend them to the full board, and then the full board votes. Let's see here. There's many reasons to reduce the county board size, and there's many reasons to keep it the same. The state average, is told people, is 24. The Redistricting Committee will listen to all sides of an issue and make their recommendation to the board. So part of that initial decision-making process will be to hear all sides of that argument. The reason to reduce, the reasons not to reduce. Not just you, the public, and then they can weigh on those in as well. And then the legal basis for the map is something very important that everybody needs to understand, and that was the main reason I wanted to talk to you today about this. It's lives, not voters. You have to equalize the population between the district based on the people that live there, not registered voters. Okay, that's a big distinction, because at 28, our deviation was no more, I believe, than 1.5%, which is very little if you think about it in a 2,000 person district. That's not much deviation between all the districts, from Herscher, the size of that one, all the way Hopkins Park, Grant Park. They're all balanced in the municipalities. Contiguous territory is nearly compact as practicable. Population overrides this. So you can go up by census blocks to get more population in another area. Okay, it becomes problematic by me looking at it when you start reducing, because you go to 24 and really to 18, it becomes more pronounced. You'll see that it's less representation for the rural areas. And when you get into the cities, in order to equalize population, you'll start to see people from Bourbonnais that will have Kankakee residents in their district, because municipal lines go away. So you were trying to balance Voting Rights Act with state statute, and sometimes they're conflicting. A good example would be Mr. Payton's area. If you were trying to equalize that population and still keep Sun River Terrace and Hopkins Park together, because that's a strong desire of that area, well, in order for them, if you go down to 24 or 18 districts, they're going to have to match up with population as the county divided by 18. So that 110,000 divided by 18, it tells you how many districts, what the population is going to be. So things will change, and change dramatically if you go the lower you go. But even at 24, it blows up the map in and of itself. So I just want to mention that this will all be visual in the committee meetings. You can divide townships or municipalities when necessary to conform to population requirements. You see everything points back to population equality, which we have right now. Don't divide precincts, but those are going to be created anyway, recreated through this process as well. So precincts are drawn after the county board map is drawn. And I mentioned the other referendum that passed by 54% that said people wanted 28 single-member districts back in 2010, along with the other referendum that said people wanted 21 districts. So they have to be balanced. Now, the other thing, and I spoke to Mr. Rowe about this, we can get an option for this redistricting software that costs $13,000 that lets the public submit their maps. So that's a decision that the board will have to make. Do we want to let the public draw maps? Now, we don't have the money to teach them how to do it. The software would be available on a portal, but they could say, well, like, here's a good example. You can't have 19 members. It cannot be a prime number. So it can be obviously 18, 20. You can have 21. It makes it problematic, because then you'd have to have 3 separate groups of people running in elections, 4 years, 2-year terms, 4-2-4, and then 2-4-4. So it's different. Usually it's divide a number divisible by 2. It works best for, but you can't have divisible by 3, just can't be prime. So obviously, 23 would be out, 19 is out, and go from there. But that $13,000 option, it's pretty expensive. I can tell you that that's more than you would save by reducing the county board by 4 members, but that's okay. If the board thinks that that's the way you want to go to give the public an option, I think it's a good idea, but I don't, the money's going to have to be discussed. because that's 13 grand. It's not a little bit. And if we're gonna save roughly 10 a year, if we reduce by 4 members, kind of tells you a little bit what's going on there. So I want to at least get that in front of everybody and make sure you understand the timelines and what the mission of this group is. You know, there's an ex-county board member who I've heard say, why does, you know, municipalities need so many board members? Well, the law says you do. It's based on population. It's not that Bradley should have one and Bourbonnais should have one and Moment should have one. It's population. It's not municipality that drives this. And I hope that resonates with everybody. Is there any initial questions there? More will come alike. Just know that we're working on this to get the committee moving as soon as we can. Any questions? Okay. It's pretty heady when you start looking at what it does and you start seeing one little change over here on this side of the county reverberates over here because everything starts moving. So, land bank, I believe that was next. Yes, land bank. All right, Ben, I guess the floor is yours. We have the Kankakee Regional Land Bank Intergovernmental Agreement that we're going to go through, and if you want to talk about this, Ben, in Genesis and any descriptors you think is necessary.
Yeah, I think we can do that. I was, because we're running such a short meeting, I was gonna read the whole document to you, but I guess I'll save you the
motion to adjourn. Yeah.
So, I'm rooting for snow still, so I know everybody wants nice warm weather. I heard comments earlier about it. I'm still rooting for snow. So on the land bank, you know, in putting this together, this has been the culmination of probably several years worth of work, but really we're talking about a pretty solid year of the staff at the city and the county going back and forth and working with Chairman Wheeler. And what I wanted to do just a little bit on the IGA was just to kind of call some of the points forward to the group to talk a little bit about you know, what a land bank is, how, you know, what it does, kind of how the tool works, and then how this partnership between you know, a city and a county, you know, a home rule city with their authority, the county being the tax trustee, really makes sense as far as putting a land bank together. I'm not going to read this quote to you, but I do feel it's poignant. This is Dan Kildee. He was the president of a group called the Center for Community Progress. He's now a congressman from the Detroit area. But I think it's very important for people to understand as we're looking at land banks and how to do this. If we were going to be successful as communities, we really have to address vacancy. And this is not only residential vacancy, and I know that's how kind of Community Progress looks at it, but it's also commercial and industrial vacancy. How do we turn properties over? There's so many opportunities for people to move into bigger and better and nicer spaces, and then they leave behind the space. And without the appropriate tools to deal with those, like the land bank, we really do, you know, kind of set ourselves into a bad position. So the land bank itself is a tool kind of a body politic, right? Quasi-governmental. It'd be a collaborative entity created between the city and the county. And the way this intergovernmental agreement is written up, we would have a 6-member board, and they would, you know, acquire residential, commercial, industrial property, sometimes hold that property, sometimes use some of the specific tools within their toolbox to promote economic development, to promote access to affordable housing, to promote an opportunity for the development community to lower basis and really make an easier transition. We've got properties, and I know Andy and I have talked quite a bit about this. We've got properties within our tax sale that have gone to 10 and 12 and 15 sale and errors, and that costs us administrative time and money as a jurisdiction to continue to keep these properties going through this. So how do we save our efforts? How do we get a tool put into place to make sure that we're not continually seeing this going back and forth, where the properties aren't profitable, the taxing districts aren't receiving their tax dollars, and what do we do for that? So think of this kind of in 3 parts. We've got a crummy house, on the left side. We've got some things that need to be done in the middle, and we turn that in. So we've got degrading houses cause issues in population decline, quality of life issues. They become fire safety issues. We have these issues within our cities. We have these issues within just the rural county. Drain the local taxing districts of their funds because you're building this levy with an expectation that you're going to receive funds, And then you end up increasing your levy because previous year's property taxpayers weren't paying taxes. So we make a deal, we make an investment, we do some work, and then what do we do out of that? We increase our tax base, we stabilize neighborhoods, we get rid of attractive nuisance, we remove derelict properties, we create business opportunities with it. So we're able to use this tool, and I think it's important as we talk about, we say a lot about tool, we use this tool to get done some of our goals. We have specific goals as it surrounds property. The land bank is not a goal. The land bank is a tool in which we could utilize to reach those goals or attain those goals. And so when we talk about how it works, a land bank being a non-for-profit, quasi-governmental entity, it doesn't cost as much to hold the properties. They're allowed to execute temporary leases. And I think maybe the fifth point down, this is a transactional nature entity. The land bank is all about picking up specific properties that we would put forward as a group, our board would talk about and say, here are our priority areas, and they would be turning those properties over. So it's all about that transaction. You get it through tax sale, you work through the redemption process, you get it picked up, you lower that basis, and you get it turned around into somebody who's gonna pay taxes, and we can build all of the program and procedures out of this intergovernmental agreement. If we wanna focus on single-family home owner-occupied for the residential properties, we can do that. We can give priority to those users. And then the final point here, the land bank is not obligated to do the highest bidder, and they can put together activities to say, if there's a need in a specific area for a certain thing, we could potentially turn it over to maybe somebody who didn't bid as high, but is offering a better return for our community. So that could be that component where we want end users to be single family, contributing properties. We want our end users to be a particular industrial or commercial user. And we can use this tool to kind of induce that, where you get that basis lower, you get and I hate to say tax wipe, but you get the taxes settled on that back taxes, we turn it over. And then, how does it apply to us? The land bank, surprisingly, and I've utilized this before, it's an amazing conduit between the property holders. The city, the county does not own the property. We want things to be done for the property, but we don't have that ownership stake. So we can work with our partner in the land bank, which is made of us, and say, we want you to go out, we want you to meet with these owners, we want you to be that conduit. They can have private conversations. They bring back to the board kind of the agreements that they're putting together. The board does authorize those agreements, but it allows that conversation to be had. It really streamlines the process. Again, lower basis, property assembly. They can bid carrying costs lower than we can bid carrying costs. We don't, I always pick on Mark, we don't want to have the county highway department out mowing grass for us. We don't do things like that. So this entity can do those things, and it can really make it a little easier for us to move together. So all of this really great tool conversation turns into, how do you get it off the ground? So,
hey Ben, quick question. Can I ask one quick question? I got to interrupt. You say the board. It's not this board, it's the land bank board.
Correct. The land bank board, which is made up of 6 members, 3 appointed by the city of Kankakee under this agreement, and 3 appointed by the county chairmen. We would, again, we'll take feedback on that part of this, but if you want to allow the chairman to pick the 3, if you want to have specific interested parties. I know that Andy and I have kind of kicked around it just internally who we think it would look good to have on that group, but that board then, and keep in mind, as this has been written and rewritten and kind of reiterated, we very much so like the idea of a 6-member board where both our local unit of government and representation that Chairman Wheeler would put forward and the city of Kankakee's representation really has to meet. We have to have project synergy. We have to have consensus on all of these things, because the 3 to 0 or 0 vote or 3 to 3 vote doesn't get anything done for us. So it really forces that cooperation, and we really like it where we're talking about an entity that could potentially, they could potentially levy taxes, or not levy taxes, but bond. They would have a bond authority within their mechanism. So we want to make sure that we're fully protected, but we also like the idea of really having properties we like to move together on, because we've got county interests, they have city interests, and we think we can make it meet with that 6-member board. That is all I have from a quick PowerPoint standpoint. I'm happy to share that with you. I just really wanted to touch on those points, and I know that there's a lot of information in this document, but the way we kind of codify this exercise is to put together this intergovernmental agreement between us and the city. Once that's executed, then we put together policies and procedures of how the land bank operates. Obviously, we've got some grant funds that'll be on executive tomorrow to talk about property. The city of Kankakee is also a recipient. Pretty excited about this stuff moving forward. This IGA allows us to get that in place so we can start the next.
So is there any initial thoughts, questions, concerns, anything about this agreement and the nature of it, I guess? Mr. Kinzinger, do you have something?
Yeah, I'm going to go back to the board of directors, and I have some issues regarding that. That's Article 5. And it looks like we've given due consideration to who should and who is qualified to be a director. But I have one question in the first paragraph, which is a concern of mine, and it's item 3, describing who this person could be, and it says an employee or agent of the member. What is an agent?
It's pretty broad. It could be somebody who's 1099. It could be a vendor of the sponsoring municipality, either the county or the city.
I don't like that.
Thank you. Thank you.
You know, this is taxpayer money, could be taxpayer money funding this, and we need to have people who are going to be paying the bills making the decisions. Now, that group of 6 directors can bring in expertise and talk to them, but I think 6 directors need to be taxpayers. Other than that, I like the criteria set forth for the directors.
So, Mr. Hunter?
Yeah, I'd like to piggyback on Ron's comments regarding stakeholders. I think of stakeholders as being individuals who reside in the county of Kankakee. Those individuals have W-2s as opposed to what you just mentioned, Chairman, 1099s. That's the concern. I concur with Ron, and I got one other question. How the bonding authority, I know that's one of the tools, but how do you determine the amount for bonding, or is that something that you go through and make assessments, et cetera, dealing with our potential, our fiscal situation?
Yeah, that would be this board, as it stands of 3 and 3, and it will require consensus amongst all members. And obviously, we would have 3 members from the county that would be voicing our opinions on any bond initiative. The next step will be the board to do their bylaws and those types of things. We have this agreement here in front of us that creates it, then the bylaws need to be created. So I think what you guys were expressing, Mr. Kinzinger and Mr. Hunter, that it needs to be a W-2 employee only, and not an agent of the board. They have to have a direct employee relationship. It could be somebody from the community, but maybe it's within Kankakee County.
Yeah, stakeholders. That's what
so
we're
we say
saying.
a W-2 employee or resident of Kankakee County or something like that.
Paying real estate taxes within the county.
Well, if they're a renter, they I could just say they're a resident of Kankakee County. Right. So
we're paying real estate taxes if they're
indirectly, yeah. So if it's okay, could I suggest how the motion would be made? From what you're saying, it would be a motion to approve with the changing that letter I, if you will, of page 5, section A, local government directors to W-2 employee or Kankakee County resident. Is that what you're suggesting?
I'll second Ron's motion.
Is that, so I have a motion to be the approval, and then there's a second. Okay, is there any discussion on that? Any dissension on that? Or anybody concurring with that? This is an important tool, as Ben mentioned. It's not just on residential, it's on commercial as well. And you really need the county, who's the county trustee, who are the only entity that's able to wipe the taxes and the fees for all taxing bodies. You need them, and then you need a home rule community who has, and then home rule is extended to whoever's part of this. And hopefully at some point in the near future, we can include Hopkins Park and Bradley and Bourbonnais and Manteno, Moments, and we have this county-wide. It'd be great. We have to start, and that's one of the reasons that I insisted it had to have something that was more regional. I suggested River Valley, Regional Land Bank Authority. That was rejected. Originally, we had an agreement on Kankakee Land Bank, or Kankakee County Land Bank Authority, and that didn't fly. So we came back with Kankakee Regional. That was suggested by the city of Kankakee. We have an agreement there. So now we're to this point. So I want to make sure, we've talked about this before, but it's been a little while we hammered out, of all things, as petty as a name, but it mattered to some of our other potential partners what the name of this group was. So any other questions? So we have a motion and a second. Yes, Mr. Kinsey. Yes.
One more thing. As I read the qualifications of director, it does not appear that it has to be some for the county's portion. That director does not have to be on the county board. It can be a qualified person outside the county board.
Exactly.
That's why I read
exactly.
it. Okay, thank you.
Yep. We can do that. It can be a county board,
but you don't have to.
Right.
Yes,
the only thing I think what you guys are saying is they have to have a local tie. If they're going to bond out, they need to be accountable to local people.
Absolutely.
And I would agree with that as well as we talk this through. Mr. Featherly had something?
Yeah, you said you were going to call it the Kankakee Land Bank?
No, that was, we wanted it to be the Kankakee County Land Bank was originally. Now it's the Kankakee Regional Land Bank Authority.
But it sounds like it just belongs to the city of Kankakee, and I don't agree with that at all.
The word regional assumes it was a compromise.
Not the people that live up here to hear about something in Kankakee Regional. I think it's down there. You need to put county in there, I believe. If we're going to be doing the crust of the work, it should say Kankakee County.
The only way that we can move forward with that, John, is if you make the motion to amend the original motion. To change the name.
To amend the original motion to include the county involved in this.
I understand.
We're the ones that brought it together. Why should we not? Why should it not have Kankakee County on it? You're putting down the buses for the Metro. Why don't you put it on the bills for the extra committees and all the extra work that's going to go on in the office there?
Yeah, well, it's just, so that's a motion to change the name from regional to Kankakee County Land Bank Authority?
Yes.
Okay, is there a second to his motion to amend the original motion? Second time, is there a motion to amend? A second to that motion? Third time?
Mr. Fairfield.
Mr. Fairfield has a motion to amend. So any discussion on this amendment? I'm going to stick with the Kankakee Regional because that's the gentleman's agreement that I made with the city. I'm not going to change after the fact. So I'm just telling you where I stand.
Chairman.
Yes, sir.
What do you think Kankakee's going to want it called?
They wanted it just to be Kankakee.
Yeah.
The Kankakee Land Bank Authority.
That's what they've said.
So originally we had an agreement on county that changed. I went back with regional. So, or they came to me with regional. I thought that was a good way to move forward.
What is the? I hate to get into minutia, Mr. Chairman. What kind of logo is going to be on the? No, seriously, no, really. I understand Featherling's concern. I don't want to see a communication with the city logo on it. You understand what I'm saying?
We will have 3 appointed members of the board that will definitely be lockstep with what the desires of the county are. Okay. Does that make sense? Because they're going to need 100% agreement on everything in order to move forward. That's the way we set this up. We don't want any, one holdout that could put we need total lockstep moving forward. So we have a motion on the floor and a second to amend. Are we ready? We have to do roll call on the amendment only to change the name. Because then it would have to go back to the Kankakee City Council for their approval on the name change and any other amendments that we come up with. So we'll have to do roll call. This is just on the amendment. Yes, if you want to change the name. No, if you don't.
Mr. Hess?
No.
Ms. Polk?
No.
Ms. Weber,
No.
Mr. Payton,
No.
Ms. Parker,
No.
Mr. Kinzinger,
No.
Mr. Fairfield,
Yay.
Mr. Carrico,
No.
Mr. Featherling,
Aye.
Mr. Miller,
No.
Mr. Long,
No.
Mr. Hunter,
No.
Mr. Wheeler,
No.
motion fails.
Alrighty, moving back, and thank you for that. And that's our right to express our opinion, and we did it. That's what we're here for.
That's a valid.
Moving back to the original, we have a motion and a second. Any more discussion? And it does include with the changes on section III of section A to read W-2 employee or Kankakee County resident. Ms. Parker, discussion?
Yes, thank you, Mr. Chairman. I just want to thank Mr. Kissinger for bringing that to our to the meeting. I really agree with what he had to say.
All right.
Mr. Chairman.
Yes, Mr. Hunter.
There'd been prior discussion with County Board member Payton and Kinzinger and yours truly, and of course, you know, we articulated our unreadiness to the chairman as well too. So what I really appreciate, based upon our discussion, and I think Ron will concur and Payton and the chairman will concur, that we had some discussion about this previously. So that's the product of board member Kinzinger's motion and my second.
All righty, moving to, are we ready to vote? Roll call on Zoom, please. Actually, roll call for everybody. I apologize.
Mr. Hess,
Aye.
Okay.
Ms. Polk,
Aye.
Ms. Weber,
Aye.
Mr. Payton,
Aye.
Ms. Parker,
Aye.
Mr. Kinzinger,
Aye.
Mr. Fairfield,
Aye.
Mr. Carrico,
Aye.
Mr. Featherling,
Aye.
Mr. Miller,
Aye.
Mr. Long,
Aye.
Mr. Hunter,
Aye.
Mr. Wheeler,
Aye.
motion carries.
All righty, thank you for that. Moving on, the next item we're gonna not discuss today. So is there's any other business for the committee? Mr. Hess?
We jumped over the governor's potential reduction.
We talked about that with the 10%.
We don't want to put this on file. Mr. McCarty made up here. The Senate?
Is he still out there?
No.
Okay. Yeah, we could, let's, I guess we could make a motion to put that on file. I don't have it in front of me. It must have,
It's in the packet.
he must have just brought it in.
Oh, it's in the packet.
Is it before? Oh, it's in the middle.
Yeah.
I missed it.
I think we ought to have that on file.
Okay. Yeah. It's part of the packet, so yes, it is, it will be on file, but, any specific questions about that, what it might mean, you know, we'll get, either Steve will answer any question you have, or we can have me discuss it tomorrow at finance. It's probably the best thing. So, we'll get specific then. All righty. Any motions?
Now I'll make a motion to adjourn.
Thank you, Mr. Hess. A second.
Polk.
Ron, so what do
Ms.
we-
Polk, a second. All those in
Ron.
favor say aye.
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 Those opposed, same sign.
What are you doing today?
Motion carries. Have a great